Hi there, I'm Sydney Dupuy, and I'm a functional medicine practitioner and your mental guide. I help women move through or into and through their menopausal years. This video is part of a series called Pulling the Curtain Back on Hormone Replacement Therapy, also known as HRT. My intent with this series is to educate and empower women who, through their menopausal years, and women who have been or have been thrown into menopause prematurely. I hope the content that you find here is helpful and inspiring and makes things and demystifies things surrounding hormones. Okay, let's get started. This video is about cancer and estrogen. It's a big topic, I know, and you've probably heard plenty of conflicting information, which makes it really hard to figure it out on your own. So we're going to tackle this together. So, does estrogen cause cancer? This is the million-dollar question for a woman when she's been through cancer treatment or entering her menopausal years. To even begin to answer this question, there are three important factors to keep in mind. First, the majority of breast cancer occur in women over 50 when their circulating estrogen is at its lowest during their whole lifespan. Menopausal women are no longer producing the boatloads of estradiol from the ovaries that they did during their fertile years. Let that sink in for a minute. Breast cancer mostly occurs when there is very little estrogen around. 2, all cancers are caused by inflammation, which is actually a driver of all diseases. Number 3, cancer is a misfolding or misreplication of DNA, which is the blueprint of our cells. This misfolding is caused by inflammation, lifestyle, our environment, and a possible genetic predisposition. Please keep in mind that what we eat and our lifestyle turn on and off our genes. So even if there's a predisposition, there's actually still a lot within our control. We probably need to talk about the variety of ways that inflammation is ignited in our bodies, because that's kind of the driver, right? It's actually quite a long list, and we're often exposed to these on a daily basis, which makes it important to know so that we can know what we can and cannot change. And through this video, you'll hear me refer to 3 different types of estrogens. It's really important to understand the distinctions between the 3 because they all act differently in our bodies. And if you would like to know more about them, I do have a video on that, and the link for that is in the description of this video. So, inflammation. It can develop because you don't have the right balance of hormones, or your estrogen metabolism pathway favors a more inflammatory route, producing a more inflammatory type of estrogen called estrone. Or you're no longer making estradiol from your ovaries, which is actually anti-inflammatory all in itself, and our fatty tissues tend to start making more of that estrone, which is very inflammatory. 2, being menopausal is inflammatory all by itself. 3, you don't have the right nutrients to help your liver do its job or keep your digestive system humming along so that they can both effectively excrete the toxins and estrogens that we no longer need. I guess, okay. 4, you're leaving out major food groups that contain the necessary micronutrients to help scavenge free radicals, which damage DNA. And these micronutrients are mainly found in fruits and vegetables. 5, you experienced or are experiencing chronic ongoing stress and maybe trauma. And this is a lot bigger than most people realize, and it's something to address. 6, inflammation can happen if you're sleep deprived or you're a night shift worker, because it interferes with your circadian rhythm, which keeps everything moving along nicely. Another reason is your body has been exposed to many endocrine disruptors, which come in the package of chemicals and makeup and the things that we put on our skin, the glyphosate that's sprayed on our our food, on our crops. And some people are better at emptying those out than others, just genetically. You have inflammation from underlying chronic infection. I already kind of talked about the chemicals from our environment, which can mimic estrogen, which we call xenoestrogens. If you have more than 1 to 2 alcoholic drinks per night, it can be a problem. If you have diabetes or pre-diabetes, and you're over 10 pounds over, or excuse me, 20 pounds overweight, you have a sedentary lifestyle, and you have excess visceral fat or a high fat to lean body mass ratio, or what I call the undermuscled body. And body composition is super important to track, and so is the visceral fat because it's highly inflammatory. So these last 4 items I took straight from NAMS, from the NAMS 2022 statement on HRT. NAMS stands for North American Menopause Society. So these last 4 items, along with smoking, are the biggest drivers of inflammation and cancer. So again, most women do not get breast cancer when there's a lot of estrogen floating around in her body. It's when she loses her hormones that she is susceptible. And it's because both estradiol and progesterone are anti-inflammatory. So estradiol controls the immune system by keeping it going into a pro-inflammatory state. And again, remember that inflammation underlines the development of all cancers. So if we have a lot of inflammation, our body tends to lay down more visceral fat. That's the fat that nestles in between our organs and can contribute to that pesky belly fat too that we find when we move into menopause. And this extra fat makes more of an enzyme. It's called an aromatase enzyme that actually converts that fat into estrogen, but it's not the kind of estrogen that we want. It's the pro-inflammatory type, again, called estrone. So I'm going to give you a quick hormone breast lesson here, something you probably don't know. The breast has its own capability of making estrogen. So no ovaries needed. Not quite true, but really. It produces the more inflammatory and proliferative type of estrogen called estrone, which stimulates the receptor sites that can be problematic when it comes to breast cancer. Since this type of estrogen is more proliferative, it can actually grow, not cause, but grow breast cancer. When you have estrogen receptor positive breast cancer, it is made, again, in the breast itself from the fat cells, which help with the help of the aromatase enzyme. So that's why many women who have had hormone positive breast cancer have taken an aromatase inhibitor to block that production of this type of estrogen in your breast and actually throughout the entire body. So let's put it together. What's the chain of events to breast cancer? So first, there may be high exposure to the xenoestrogens from our environment and or a woman's ability to metabolize estrogens down a favorable pathway may be compromised, or maybe her liver isn't working as effectively, or the digestive system isn't working the way it should be to dump those estrogens out when we're done with them. Or maybe there's inflammation coming from somewhere else. And remember, once you hit menopause, there's little to no estradiol or progesterone circulating to calm down all of that inflammation, unless a woman is actually on HRT. And then you get that calming effect. So then this inflammation causes the DNA damage, which equals the growth of cancerous cells that begin to replicate. Those cancerous cells cause even more inflammation all on their own in the breast tissue surrounding the cancer, including the fatty tissue, which is where, again, that aromatase enzyme is made. So we've got the differentiation of the cells happens first, and then that causes inflammation, and that causes more of the aromatase enzyme, and it's a whole circle and cascade of events. So I'm going to get a little bit technical here, but I think it's really important. Estrone, which is the type of estrogen mainly that comes from our fat cells, acts on the alpha receptors. The breast cancer has alpha receptors. And then we have estradiol. That's the hormone that is most commonly used in HRT and is the type of estrogen that is circulating abundantly in our fertile years. And that particular type of estrogen has both alpha and beta. So the alpha is the calming, the beta is the more inflammatory. And it works on both, but a little bit more on the alpha. And then we have the estriol, which is the third type, which is the weakest type of estrogen that we have. And it works on the beta cells, on the beta receptors. So, you know, that menobelly that seems to show up out of nowhere once we're nearing menopause, it's actually our body's way of trying to, the best way to know is how, to make more estrogen as our ovaries start to shut down their production of estradiol. So it starts to lay down more fat because it actually does want some estrogen. But unfortunately, most of that estrogen converted from the fat, again, is the estrone through the aid of those pesky aromatase enzymes. So again, the cause of breast cancer has nothing to do with hormone replacement therapy or using bioidentical estradiol, estriol, and bioidentical progesterone. In fact, there have been meta-analysis studies again and again, also stated in the NAMS 2022 statement, that indicate that the use of estradiol actually reduces the reoccurrence of breast cancer and reduces the risk of death from cancer and all-cause mortality. So taking estrogen replacement lowers all-cause mortality. And the studies show that estrogen only, HRT, reduces the reoccurrence of breast cancer by about 20 to 30%, and bioidentical estrogen plus the progesterone combined, contrary to the initial report from the Women's Health Initiative study, which, by the way, I have a video on that too to explain what happened surrounding that. Anyway, the estrogen and progesterone combined also may reduce breast cancer, and none of these studies show that bioidentical HRT causes more death or causes cancer. And as Dr. Felice Gersh, she's an OBGYN here in California, she is, in my mind, super, super knowledgeable when it comes to hormone, when it comes to cancer and hormones. And she's got a great YouTube channel. I invite you to check her out. She says, don't be afraid of our life-sustaining hormones, but do be afraid of the chemicals that surround us, including pharmaceuticals, and do be wise to what we put into our mouths and take a hard look at our lifestyle. So, how could HRT, hormone replacement therapy, possibly reduce cancer? I've already mentioned some of the wonderful things that estradiol does in a previous video, but we'll review it here real quickly. Estradiol reduces inflammation. It helps to turn on tumor suppressor genes that downregulate the ability to create cancer cells, and also promotes a process that takes old cells and gets rid of them, which helps new cells stay healthy. So it's kind of like trimming dead branches and pulling off the leaves. So you get rid of that nasty old growth that's not doing anything, that's actually harming the plant. And then we have this new nice growth coming up. So again, the vast majority of women who develop breast cancer are postmenopausal women who don't have much estrogen. Now, young women can and do get cancer, and it's unfortunately becoming more frequent, due probably to our environment and probably even due to what their parents passed down to them in terms of a toxic load. And yes, there's genetics. And I'm going to go out on a limb here and say that the work and stress load that so many women have today is, I believe, a huge driver. And it's something that women did not have to the same degree that we do now, you know, 2 and 3 decades earlier. And it's just kind of accepted as part of life now. So again, the cancer we mainly see in young women is not due to the estradiol their ovaries make, but the inflammation that's created for one reason or another, most often fueled by lifestyle stress or environment. And there can be something hidden too. So can a woman on HRT get cancer? Yes, she can. Most cancers develop over a 20-year period. Cancers have started to grow well before menopause sets in, and then it most often takes off with the increase in inflammation from lifestyle, environment, and or no hormonal support to keep the inflammation at bay. But the fact that it's already been starting, and there's other many sources of inflammation that a woman can be getting that from, the HRT is not the end all and it's not the be all. All right. Is it wise to give a woman HRT when she is, while she has active cancer? Probably not. All estrogens are somewhat proliferative, which means they make things grow. And even estriol, which is the weakest of the three estrogens, if in high enough amounts, may actually be a problem as well. But this does not mean that exploring the use of HRT to make a woman's quality of life better after her treatment should not be discussed, especially vaginal estrogen, which stays local. So some may think that I believe HRT is the end all be all, but I don't. But I would like to see cancer thrivers in all menopausal women to understand the playing field and know their options so they can advocate for themselves, whatever that might look like for them. There are many women, young and old, who after the cancer treatments have very compromised quality of life because they have no hormones on board. And these are the women who have vaginal atrophy, ongoing UTIs, their intimate lives go to zero, which can be devastating to many relationships. They have horrible sleep, debilitating brain fog or depression, signs of dementia, weight gain, osteoporosis, and heart disease, which, by the way, is the #1 killer of postmenopausal women, not cancer. Now, not every woman will experience the list that I put above. Maybe 1 or 2 items, maybe not even that, but I see plenty that do. And even most of my menopausal women who have not had cancer, who have some of these symptoms, have never been offered hormone therapy, let alone those who have had cancer. There are too many doctors and women who are still misinformed and are afraid of HRT, and I understand. Even AI says that HRT can increase the risk of cancer. And if AI hasn't been able to navigate all the mixed messaging out there, how the heck is the average woman supposed to figure it out? As always, I like to stress that no one size fits all, and no one has the right to dictate what we can and cannot do for ourselves, even our doctors. But the only way, at least in my mind, to become our own best advocate is to learn. Knowledge is our key. It really is powerful. And I encourage every woman to educate herself as much as possible and work with her doctor to determine what is best for her. And I think it's really important that you find a doctor who will work with you, who will listen to you, and who will be open. So part of my job is to help you become informed, to be a better advocate for yourselves. I plan on adding more videos here. And if you like this video, please hit the like and subscribe button to be notified when there's something new to view. I would like to leave you with some resources so you can further explore on your own, and I hope you will. And you'll find these in the description section. If you'd like to set up an intro call with me to explore how I may be able to help you, please go to my website. The schedule is to schedule a call, and that link is in my YouTube bio. All right, that's it. I hope that was helpful, and take care.